Welcome to today's video where we'll discuss pancreatic cancer. It is one of the most elusive and formidable malignancies, often evading detection until it has reached an advanced stage. Ranking as the third leading cause of cancer-related deaths in the United States, this aggressive disease underscores the vital importance of early diagnosis in improving survival rates. Nestled deep within the abdomen, the pancreas serves as a powerhouse of digestion and blood sugar regulation, yet its concealed location makes early detection exceedingly difficult. Tragically, many individuals remain asymptomatic until the cancer has progressed significantly, contributing to its grim prognosis. But there is hope. By recognizing the often overlooked warning signs, subtle changes that may indicate trouble, we can enhance the likelihood of early intervention and, potentially, save lives. In today's video, we'll unravel these critical symptoms, from jaundice to digestive disturbances, explaining how they relate to pancreatic function. We'll also explore the key risk factors that may elevate your susceptibility to this disease. If you're ready to arm yourself with essential health knowledge, show your support by hitting the like button, subscribing to the channel, and joining us as we delve into this crucial topic, starting with the first sign. One of the earliest and most striking warning signs of pancreatic cancer is jaundice, a condition that causes the skin and the whites of the eyes to take on a yellowish hue. This occurs due to an excessive buildup of bilirubin, a yellow-brown pigment produced when the liver breaks down aging red blood cells. In a healthy body, bilirubin is processed by the liver, mixed with bile, and transported through the bile duct into the small intestine, where it aids digestion before being excreted through stool. However, when a pancreatic tumor forms in or near the head of the pancreas, it can obstruct the bile duct, preventing bilirubin from draining properly. As a result, bilirubin accumulates in the bloodstream, leading to the characteristic yellowing associated with jaundice. Jaundice doesn't just cause skin discoloration, it often brings additional unsettling symptoms. One of the first changes many people notice is dark-colored urine, which takes on a deep amber or brown hue because the kidneys attempt to remove excess bilirubin from the body. Meanwhile, stools may appear unusually light, pale or clay-colored due to the lack of bile reaching the intestines. Since bile also helps break down fats, individuals with obstructed bile flow might experience greasy, foul-smelling stools, steatorrhea, that are difficult to flush. Another troubling effect of bilirubin buildup is severe itching, pruritus, which occurs when excess bile salts accumulate in the skin, irritating nerve endings. This itching can be relentless, affecting sleep and daily activities, and may appear before the yellowing of the skin becomes noticeable. Some individuals with jaundice may also experience nausea, loss of appetite, and an overall feeling of fatigue as the liver struggles to process toxins efficiently. While jaundice is not exclusive to pancreatic cancer, it is a major red flag, especially when accompanied by unexplained weight loss, digestive discomfort, and upper abdominal or back pain. Other conditions, such as hepatitis, gallstones, or liver disease, can also cause jaundice, but when it stems from pancreatic cancer, the symptoms tend to progress silently until the disease reaches an advanced stage. Because pancreatic cancer is often diagnosed late due to its subtle and easily overlooked symptoms, recognizing jaundice as a potential early warning sign is crucial. Many people dismiss mild yellowing of the skin or changes in urine and stool color, attributing them to temporary digestive issues or dehydration. However, ignoring these signs could mean missing a critical window for early detection. If you or someone you know develops jaundice without an obvious cause, do not wait. Seek medical evaluation immediately. This seemingly benign discoloration might be the only visible signal your body gives before the disease progresses further. Next, unexplained nausea and frequent vomiting can be early indicators of pancreatic cancer, particularly when they arise without an obvious cause and persist over time. While occasional digestive discomfort is common, nausea and vomiting associated with pancreatic cancer tend to be more persistent, unpredictable, and gradually worsening. These symptoms often stem from the physical effects of a growing tumor within the pancreas, which can interfere with the normal function of the stomach, intestines, and digestive enzymes. As a pancreatic tumor expands, it may press against the stomach, duodenum, the first part of the small intestine, or surrounding organs, partially obstructing the passage of food. This obstruction can create a sense of fullness after only a few bites of food, leading to early satiety, bloating, and increasingly frequent waves of nausea. In more severe cases, this blockage prevents food from moving properly through the digestive tract, resulting in episodes of vomiting, which may contain undigested food from previous meals. The intensity of nausea and vomiting often worsens after eating, particularly with fatty or heavy meals, as the pancreas plays a key role in digesting fats. When pancreatic enzyme production is compromised, foods rich in fats become difficult to process, intensifying nausea, discomfort, and indigestion. Another important aspect to consider is the relationship between nausea, appetite loss, and unintended weight loss. Many individuals with pancreatic cancer develop an aversion to food, as eating frequently triggers discomfort. This, combined with the feeling of fullness and nausea, can lead to a significant drop in caloric intake, ultimately resulting in rapid, unexplained weight loss, a common hallmark of pancreatic cancer. Additionally, some individuals experience acid reflux or a bitter, unpleasant taste in the mouth, which can further discourage eating and contribute to nutritional deficiencies over time. While mild nausea and occasional stomach upset can result from common digestive issues such as stress, food poisoning, or acid reflux, nausea and vomiting linked to pancreatic cancer tend to persist and intensify over time rather than resolving on their own. If these symptoms become a frequent pattern, especially when accompanied by loss of appetite, bloating, digestive discomfort, or other unusual signs, it is essential to seek medical evaluation. Early detection is key, and addressing persistent digestive symptoms promptly could help uncover a serious underlying condition before it progresses further. If nausea and vomiting seem relentless and out of the ordinary for your body, don't ignore them. Your pancreas may be sending a critical warning signal. Next, experiencing relentless, unexplained itching across the body might seem like a minor nuisance, but when it persists without an identifiable cause, it could be an early warning sign of pancreatic cancer. This type of intense, unrelenting itch, also known as pruritus, differs from the occasional irritation caused by dry skin, allergies, or insect bites. Instead of being localized to one area, the itching often affects large portions of the body, making it difficult to pinpoint a specific trigger. What makes this symptom particularly concerning is that it can appear before visible jaundice develops, making it an important early clue that something is amiss within the body. The primary reason pancreatic cancer can lead to severe itching lies in the obstruction of the bile duct. The pancreas is closely linked to the liver and gallbladder, and when a tumor forms near the head of the pancreas, it can partially or fully block the bile duct, preventing bile from flowing properly into the intestines. As a result, bile salts and bilirubin build up in the bloodstream and eventually deposit into the skin, triggering an intense itching sensation. Many individuals describe this itch as deep, persistent, and nearly impossible to relieve, as standard remedies such as moisturizers, antihistamines, or hydrating lotions offer little to no relief. The itching is often most pronounced on the palms of the hands and soles of the feet, but it can spread across the entire body, creating significant discomfort that disrupts sleep and daily activities. In addition to severe itching, individuals may also notice other skin-related symptoms that accompany bile buildup. Over time, the skin may take on a yellowish tint, jaundice, and some people experience dry, flaky skin, a waxy texture, or an unusual sensitivity to sunlight. The accumulation of bile salts can also contribute to dark-colored urine and pale, clay-colored stools, further signaling an issue with the liver and bile flow. While pruritus can result from a variety of conditions, including liver disease, kidney disorders, autoimmune conditions, or allergic reactions, the key difference in cases related to pancreatic cancer is its progressive nature and resistance to common treatments. If you are experiencing persistent, unexplained itching that does not subside with traditional remedies, it is crucial to pay attention, particularly if it occurs alongside other unusual symptoms such as weight loss, nausea, fatigue, or changes in digestion. Your skin could be alerting you to an underlying issue before more serious symptoms develop. If this relentless itching remains unexplained, seeking medical evaluation sooner rather than later could be a life-saving decision. Next, persistent abdominal pain, particularly in the upper abdomen, can be an early but often overlooked warning sign of pancreatic cancer. Unlike temporary stomach discomfort caused by indigestion or gas, the pain associated with pancreatic cancer has distinct characteristics that set it apart. It is frequently described as a deep, dull ache that originates in the upper middle or upper left abdomen and can radiate toward the back. Many individuals notice that this discomfort intensifies when lying flat, but may improve slightly when leaning forward, a telltale sign that the tumor is exerting pressure on surrounding nerves and organs. As the tumor enlarges, the pain becomes more pronounced and persistent, often described as a gnawing sensation that doesn't go away. This discomfort can worsen after eating, especially following fatty or heavy meals, due to the pancreas' role in producing digestive enzymes. When a tumor interferes with normal pancreatic function, the digestion process becomes impaired, causing bloating, fullness, and increased pain after meals. Some individuals even find themselves avoiding food altogether due to the discomfort, which can contribute to unintentional weight loss. One key feature of pancreatic cancer-related abdominal pain is its chronic and progressive nature. Unlike pain from common gastrointestinal conditions, such as acid reflux, ulcers, or mild indigestion, which may fluctuate or improve with medications, the discomfort linked to pancreatic cancer tends to persist and gradually worsen over time. Additionally, some patients report that the pain follows a daily pattern, intensifying at night or during periods of physical inactivity. While abdominal pain is a common symptom of various digestive disorders, it becomes concerning when it is persistent, unexplained, and resistant to common treatments. If you experience ongoing upper abdominal pain that spreads to the back, worsens after meals, or persists despite lifestyle changes or medications, it is crucial to seek medical attention for further evaluation. Recognizing and addressing these symptoms early could be the key to detecting pancreatic cancer before it reaches an advanced stage. Next, a sudden and unexplained diagnosis of diabetes, particularly in individuals with no prior history or clear risk factors, could serve as an early red flag for pancreatic cancer. The connection between these two conditions stems from the pancreas' vital role in regulating blood sugar. This organ houses specialized cells that produce insulin, the hormone responsible for controlling glucose levels in the bloodstream. However, when a tumor begins to develop in the pancreas, it can disrupt normal insulin production, leading to elevated blood sugar levels and the rapid onset of diabetes-related symptoms. Unlike type 2 diabetes, which usually develops gradually over time due to factors like obesity, sedentary lifestyle, or genetic predisposition, diabetes linked to pancreatic cancer often appears suddenly and progresses aggressively. Individuals who were previously in good health may begin to experience intense thirst, frequent urination, persistent fatigue, blurred vision, and unexplained weight loss. These symptoms occur because the body struggles to regulate glucose levels effectively, either due to a reduction in insulin production or because the pancreas no longer responds properly to insulin signals. In many cases, pancreatic cancer-induced diabetes is classified as new-onset diabetes in adults over 50 who have no family history of the condition. Another clue that diabetes may be linked to pancreatic cancer is if blood sugar levels fluctuate unpredictably despite following standard diabetes treatments. Some individuals also find that they rapidly lose weight without making any dietary or lifestyle changes, which can be a sign that the pancreas is failing to function properly due to tumor growth. It is important to emphasize that most cases of diabetes are not caused by pancreatic cancer. However, if you or someone you know has been diagnosed with diabetes unexpectedly, especially without clear lifestyle-related risk factors, it is worth discussing further testing with a healthcare provider. Early detection is key, and understanding this subtle but significant connection could play a crucial role in identifying pancreatic cancer at an earlier, more treatable stage. Next, the color and consistency of stool and urine can provide significant insights into your digestive health, and persistent abnormalities might be an early indication of pancreatic cancer. When a tumor develops in the pancreas, it can interfere with bile flow, a crucial substance that aids digestion and gives stool its normal brown color. If the tumor obstructs the bile duct, bile fails to reach the intestines, resulting in pale, clay-colored stools. At the same time, excess bilirubin, a yellowish pigment processed by the liver, starts accumulating in the bloodstream, leading to darkened urine, often appearing amber or brown. Another concerning change is steatorrhea, a condition where stools become greasy, foul-smelling, and difficult to flush due to undigested fats passing through the digestive system. This occurs because the pancreas loses its ability to produce essential digestive enzymes, impairing the breakdown of dietary fats. These stools often appear oily, float on water, and leave a residue in the toilet bowl, serving as a visible sign of pancreatic dysfunction. While diet, medications, and minor digestive issues can also cause stool and urine changes, persistent or worsening alterations, especially when accompanied by other symptoms, should never be ignored. If you notice continuous changes in bowel movements, dark urine, or fatty stools, it's essential to seek medical evaluation promptly. Early intervention can make a significant difference in diagnosis and treatment outcomes. Understanding the risk factors for pancreatic cancer. Pancreatic cancer can develop in anyone, but certain factors increase the risk significantly. Identifying these risk factors can help individuals stay vigilant and seek early screenings when necessary. 1. Genetic predisposition. A family history of pancreatic cancer or certain genetic syndromes can increase the likelihood of developing the disease. Specific gene mutations, such as BRCA1 and BRCA2, are strongly associated with a higher risk. Those with a strong family history may benefit from genetic testing and routine screenings to detect potential issues early. 2. Age-related risk. The likelihood of developing pancreatic cancer increases with age, with most cases diagnosed in individuals over 65. As we grow older, regular health checkups become even more important, especially if additional risk factors are present. 3. Smoking. Smoking is one of the most significant lifestyle-related risk factors for pancreatic cancer. Smokers are at a markedly higher risk compared to non-smokers. However, the good news is that quitting smoking gradually reduces this risk over time, making smoking cessation a crucial preventive measure. 4. Chronic health conditions. Certain long-term health conditions, such as type 2 diabetes and chronic pancreatitis, have been linked to an elevated risk of pancreatic cancer. If you have these conditions, monitoring your health closely and adopting a healthy lifestyle can help reduce potential complications. 5. Obesity and sedentary lifestyle. Excess body weight, particularly abdominal fat, has been associated with a greater risk of pancreatic cancer. A balanced diet, regular physical activity, and maintaining a healthy weight can lower this risk significantly. 6. Exposure to harmful chemicals. Individuals who work in industrial settings, particularly in metalworking and chemical industries, may face increased exposure to carcinogenic substances. Prolonged contact with certain toxins and workplace chemicals has been linked to a higher incidence of pancreatic cancer. Ensuring proper workplace safety measures and minimizing exposure can help reduce this risk. While experiencing one or even several of these symptoms does not automatically indicate pancreatic cancer, it's crucial to pay attention to your body's warning signs. Many of these symptoms can be caused by less serious conditions, but early detection is key to improving treatment success and survival rates. If you found this information valuable, please give this video a thumbs up and subscribe for more health-related insights. Stay informed, stay vigilant, and check out our other videos for more crucial health tips that could help save lives. Your support helps us reach more people with essential health knowledge.